Helen Farmer. It's 2:04, and the text lines are open. We are talking animals next, and I've got a competition as well. Up for grabs, we have got a pair of tickets to go along and see Deep Purple. They are coming to Dubai, in fact, the Middle East, for one night only on the 20th of November. 50 years of rock history on the stage there. And if you want to win those tickets, to go into the draw, you need to name this iconic Deep Purple track.
I got a certain little girl, she's on my mind. No doubt about it, she looks so fine. She's the best girl that I ever had. Sometimes you're gonna make me feel so bad.
If you need a clue, and I did, the track was covered by Cooler Shaker, a British band, back in 1997. The name of that track and your name to 4001, or you could use the app or the WhatsApp. We'll pick a winner before the end of the show. Good luck.
This is Afternoons with Helen Farmer on Dubai Eye 103.8.
Sponsored by Modern Vet, Dubai's truly 24-hour emergency hospital. More than just on call when seconds matter.
To the pet parents listening today, if your animal becomes suddenly unwell or even injured, every second counts. But would you know what to do in a health emergency? Heat strokes, poisonings. Dubai vets are warning that there are so many common emergencies that can turn life-threatening if not acted on quickly. So joining us today, we've got Dr. Theodora Gavriil, who is the emergency and critical care specialist at Modern Vet. Over a decade of experience in the US, Europe, UK, and now here in the Middle East. And she's here to explain what us pet owners need to know and how to be prepared when the unexpected happens. Before we talk advice, Doctor, I need to know about what you have at home, your own menagerie. Do you have any pets back home?
Oh, yes, I do. Good afternoon.
Hi.
Thank you for inviting me.
My
It is
pleasure.
an honor to be at such a reliable source of information.
Well, thank you for your insights. But I always feel like now I'm like, okay, I know your name, but now I need to know what your pet is called. So
my pet is Lizzie. She's actually the second love of my life. The first one lived to be 17 years, and she was the reason I became a vet.
Wow.
She traveled with me everywhere, and yes.
What a beautiful why behind what you do. And Lizzie's a little dog.
Lizzie is a little dog. Kizzy was the first one as a little dog as well. Those who know me, who are listening, will know what I'm talking about.
Well, I have to tell you, my first pet love of my life was called Lizzie. And and I don't say this lightly, I have never known such a kind of pure, unconditional love in my life. We adopted her when she was 8. And it was one of the best decisions I've ever made, to have years with her and for her to be so grateful. And I just want to say, if you have the opportunity to adopt a senior animal, you will just be showered with love and gratitude for all of their days. So I'm really glad you're here, not just as an expert vet, but obviously as an animal lover doctor. And we are talking about emergencies today. And it is one of those things, much like in human health, there are skills, there are pieces of information that we need to know that we hope we never need to use, but the confidence to know where to go and what to do should the worst happen. Can I ask you, what are some of the most common pet emergencies that you see here in Dubai?
Well, there are a lot of things that can constitute an emergency, but I'm going to take a step back and go back to that human-animal bond that you mentioned, because that's a good sign and a good thing to think about. So the human-animal bond does give you benefits as a person and as a family, but also it's the number one thing we need to trust when it comes to emergency. So as a human parent and a family that owns a pet, you are the best and the first line of diagnosing an emergency.
Knowing if something is wrong.
Yes. And I need to focus this, I can't focus this enough, saying trust what you feel. You come back from work and you see your animal has been sick on the floor, but also is hiding behind the couch, for example, and you're worried. Trust that worry, pick up your animal and go to the hospital. Don't wait until tomorrow or, maybe I should call someone and ask. No. Because
the last thing you want to do is look back and go, what if? Or I should have. It would be devastating. It really, really would. And
it is a bidirectional bond, and you would know inside you when an emergency constitutes an emergency. That being said, we can set some rules. For example, any trauma, anything that has to do with the eyes, anything that has to do with different breathing, And any blood you see, all those things are by default emergency.
As I said, Doctor, you've worked around US, Europe, UK. Are there anything you see specific to this region, perhaps more commonly than anywhere else because of, well, I'm thinking climate, obviously, lifestyle. Have you noticed any patterns geographically?
Definitely. Heat stroke is something that would be amiss to not mention, of course, because of the weather. That being said, it's not too much elevated over here because the animals that had time here are able to adjust. Still, it is a sneaky condition that is life-threatening. Also, accidents, cats jumping off balconies, car accidents are quite common over here. And then toxicities, definitely.
Would you mind giving us a quick recap on things that are on the no-no list when it comes to foods and things that might be accidentally ingested by an animal?
I can give you a statistical view. Cats, lilies, dogs, chocolate. Onions is not something that's very commonly known, but it is toxic for dogs and cats. So it does exist in human food, and sometimes we overlook that it is present in our recipes. Also, fats in dogs can cause pancreatitis quite elusively while we don't think about it. But the dog pancreas and the dog metabolic system is not as fast reacting as the human. So they can't have this change from fat to lean food suddenly.
So it's like a different metabolic system.
Yeah.
Interesting. Okay, we're going to keep Dr. Theodora with us today. Any questions, 4001. I want to come back to that toxicity piece because, our small dog Joy having, a box of chocolates is very different to a Great Dane having, a lick. How do you know, and what should you do if a pet has ingested something toxic? What are some of the big signs that, okay, we need to get to Modern Vet now?
I'm glad you asked that question because that is where we miss most of critical action that we could do. So when an animal is sick, it's going to do the exact opposite of being sick. It's going to hide it. It's going to not express pain. It's going to seclude him or herself. It's going to eat less, maybe seek attention less, be lethargic, hide. The more sick the animal is, the more it's going to bother you less, the more it's going to hide it. And that's within the nature. So there are no signs. It's the lack of signs most of the times.
I've heard that in cats, that you might not realise that a cat is in pain. Whereas our dogs, I'm not going to lie, are very attention-seeking, and they'll do quite exaggerated limps, and then you'll take them to the vets and go, "Oh, where was the limp that you were doing?" But that comes back to your point earlier about trusting your instinct. No one knows this pet better than you, and having a vet that's maybe it's the first time you meet them, but hopefully you've got a trusted relationship with them. They've got their notes, they've got their history, and I think sharing awareness like this about what they shouldn't be having and what to do next is really crucial.
Also, pain is not always involved in emergency.
Yes.
The rare occasions that it is, yes, it will be obvious and it will be suspected, but pain is not always a clinical sign of an emergency, and we can't have that in our mind as well. But there is a lot that we can discuss about the way of thinking of emergency for people to understand.
We are going to come to that next. I'm also keen to talk about what resources are available. What is the difference between having an on-call vet, that emergency number, and actually a fully staffed team should the worst happen. Dr. Theodora Gavriil is with us today, emergency and critical care specialist at Modern Vet. If you've got any questions for her, you're more than welcome to get in touch with us on the usual numbers. 4001 is the SMS, the app and the WhatsApp available for you as well. And don't forget, if you want to send in a photo of your pet or tell us what they're called, be happy to give them a shout out.
Dubai Eye 103.8 traffic.
Sponsored by Yas Island Abu Dhabi. Stay at iconic hotels and play at record-breaking theme parks. Book now on yasisland.com.
13 minutes past 2. Jennifer Crichton, what's happening on our roads at this hour?
Definitely getting busy now. Hessa Street and Sukim Street both looking patchy but reasonably free flowing. The Al Khail Road very slow moving from Gadir Altair to the Dubai Hills turn off southbound, and also from D3 to Business Bay. The E11 around the creek, around the canal just before Business Bay. You're going to hit a slowdown, and you're going to be in that until basically Healthcare City. It's very, very slow moving right now, northbound. Very slow indeed, particularly around downtown and DIFC. We have an accident on the D83 between Dubai Festival City and Ramul. That one is causing quite a few issues back towards the Sheikh Zayed Road. We have very slow moving traffic northbound on the 311 from Al Waka all the way up to Sharjah's safe zone. There's also an accident on the 311 southbound around the safe zone as well. And then on the E11 Sheikh Zayed Road, getting busy around DXB in patches in both directions, but then you're really going to hit the slow moving traffic around Al Nada Park, and then it's slow moving in both directions through Sharjah city centre. We've also got an accident in the industrial area causing some issues, and another one that just disappeared from my map, so hopefully that one has now cleared. If you do see anything I've missed though, let me know. 4001 on the texts. Don't text us until you're stationary, please.
Well said, Jennifer Crichton. Only get in touch when it's safe to do so. Thank you.
Dubai Eye.
103.8.
Just looking ahead to this time tomorrow, it is going to be Eye on Education with Repton School Dubai and me, Helen Farmer. That's Thursdays from 2. We're going to be talking about sustainability in the curriculum. What are some of the job opportunities that could be coming your child's way if they lean into the environment? And hearing from some students as well. Plus encouraging a love of reading in our kids from tots to teens. We're going to be hearing from authors, bookshop owners, and of course, would love you to join our kids book club. Let us know, what are your children reading, so we can share that with the good people of the UAE. That's Eye on Education tomorrow from 2. The weekend, you're listening to Dubai Eye 103.8. Helen Farmer with you through until 4. We're talking independence versus safeguarding from 3. So how do you know when your child is ready to cross the road? Keen to get your take on that.
This is Afternoons with Helen Farmer on Dubai Eye 103.8.
Sponsored by Modern Vet, Dubai's truly 24-hour emergency hospital. More than just on call when seconds matter.
We are talking emergencies this hour when it comes to our beloved pets. You know, a midnight fall from a balcony, a dog collapsing after a walk in the heat, a cat swallowing something toxic, just discussing lilies there. These are the kind of emergencies that Dubai vets see all too often. So how do you know the red flags? What steps can you take? Dr. Theodora Gavriil is with us today from Modern Vet, who's dedicated her career to emergency and critical care. And today sharing what every pet parent should know. This might sound like a very basic question, but I'm kind of keen to get an understanding of terms and definitions, and I guess what pet owners should be looking for, asking for when it comes to an emergency vet or clinic, because there is a difference between having an on-call vet or an emergency number and actually a fully staffed team.
Definitely. I'm glad you asked that question, because that gives us an opportunity to set up a definition that and try to make it as clear in our minds. Medicine is about why an animal is sick. Emergency is about how. And that is a big difference in the way of thinking and in the way of practicing medicine. That's why emergency is a specialty and it's separate. And it takes a lot of years of education and experience. The second difference is that medicine is what every vet does. Emergency is a team. You cannot have one vet being an emergency vet. I am an emergency specialist, but I can never function on my own. It is all about a team. A fast, well-coordinated group of people that are thinking on the how and not the why, which sounds theoretical, but it's actually the huge difference. Time is also very important. So after the first step that we said, trust your feeling that something's wrong with your animal, even if you don't know why. Time is of the essence. So hospital. I understand a lot of your audience also is about kids. So think about kids. When your kid is sick, it's not your pediatrician that you're going to call. You just grab your kid and go to the hospital. Same thing with pets. Time is of the essence. So get in the car with your pet, maybe communicate through while you're driving. You know, if your co-driver can communicate to the clinic and give them a heads up of what you have seen, and then trust the team to be on top of this, because every minute counts.
I think that's a really important distinction. And you actually paint quite a beautiful picture of this kind of choreography that's happening about team members anticipating their colleagues' needs, what happens next, every second counting. Why were you drawn to this area of medicine, Doctor? Why was it emergency care that you wanted to dedicate your career to?
you have to give up a lot to dedicate yourself on emergency. You have to be comfortable with not knowing, like I said. But the minute-to-minute coordination of stabilization is something that it's like a dance, like you said. You work close with people on high-stress environment. You coordinate with a team that is in sync. And that is a wonderful way to work. Although there's a lot of adrenaline and a lot of pressure, it is also very rewarding.
Sure.
Because then you can stabilize the patient, and then you can hand it over to the medicine who will address the why and
The what next.
Yes, and fix. But without that first initial step, you will lose more than 80% of your emergencies.
And what about the importance then of equipment and facilities when it comes to emergency care? Because it's not just about the people, it's about what's on hand once you get to that environment, presumably.
Right, definitely. When we're talking about a team, we're talking about a clinic that will have the equipment and the way of thinking as an emergency. I can't stress this enough. There is a different way of functioning when you have an emergency hospital rather than a veterinary clinic. It's a way that you work, a way that you address everything that comes in. And not just being prepared, because, you know, we've all been medicine vets and we've all been woken up in the middle of the night. Hey, my dog is vomiting blood profusely and he's collapsed on the floor. And you have to wake up and get your thinking and try to, you know, get your head together and get to the clinic in like 30 minutes with Dubai traffic.
Depends on the time of day.
Something like that. While in contrast, a hospital is there ready, and by the call, they will be able to not just give you first aid, but will be waiting for you with the oxygen and running and everything to successfully address this the best way possible.
And doctor, for anyone who's listening to this who wants to be better prepared, whether it is, I don't know, pet first aid or things to never have in the home or best practice, both as a vet and an animal lover of, you know, couple of decades, what's the one bit of advice you'd give to every pet lover, pet parent listening about handling emergencies calmly and effectively?
The first step we talked about, trust your instinct. Second step is don't waste time. Just grab your pet, get in the car, go to the hospital. On the way to the hospital, you can speak, or when you get there, you know, give your information. But don't try to think, reason, or consider, oh, what could have happened. That is a lot of waste of time. And also trust that there's a hospital there, thank God, because there hasn't always been in Dubai, from what I understand. Right. And that's what attracted me to this beautiful city, was that there was a hospital that is actually doing emergency.
And taking it very seriously.
Yes. And people will understand the difference, because you could see, you trust your own vet, yes, of course. But then when it comes to emergency, you have to trust the hospital.
I think it's a bit like, you know, we have the emergency numbers for the, you know, the human emergencies on our fridge. For me, it's peace of mind of knowing, okay, should we wake up to hear something's happened, or pain, or, as you say, blood from our, you know, from our animals. Okay, right, we get in the car, we go and see Dr. Theodora. You'll be ready and waiting.
It's better to do that drive, come there and find out it wasn't something life-threatening, rather than waste those 10, 20 minutes of thinking about it, or what should I do, or calling, trying to find somebody on the phone to tell you this is an emergency or not. Those 20 minutes might be the difference between life and death.
Thank you so much for your time today. As I said, a great one to have in your little black book. Dr. Theodora, Emergency and Critical Care Specialist at Modern Vet. If you'd like her details, you can just send me the word vet. I'd be very happy to send you the website so you can find out more about not just the emergency offering, but of course the whole team. So don't forget, Pets and Vets is back. We're going to be bringing you all the expert animal information and insight and advice. And there's lots more to come right here on Dubai Eye 103.8.